is a health note. Check it out now. This is a health note. This is a health note.
My name is Karen Whitaker. I'm the RN health educator at Rocky Mount OIC. Today I'd like to talk to you about diabetes. You might ask yourself, what is diabetes? Well, diabetes is a metabolic disorder in which your body has an inability to regulate your blood sugar levels. Blood sugar levels are regulated by a hormone called insulin that's made in your pancreas. There are different types of diabetes. Type 1 diabetes is when your body has no way to properly make insulin because of an autoimmune response in which the beta cells of the pancreas are destroyed. These people will have to take insulin shots for the rest of their lives. Type 2 diabetes, on the other hand, can be a combination of the inability of your body to make enough insulin, or your body has no way to respond properly to those insulin. That's called insulin resistance. You may ask yourself, how does a person get diabetes? There are many risk factors that can predispose you to developing diabetes. The number one risk factor is a family history. This means if your mother, father, brother, sister, anyone in your immediate family has developed diabetes in their lifetime, you are more at risk. Also, having a sedentary lifestyle or lack of physical activity can cause you to be predisposed to have diabetes. If you have a diet that is high in refined or processed carbohydrates, which means anything with sugars and starches, high fructose corn syrup, which is in beverages, sweet teas, also in breads, pastas, rices, excessive thirst, excessive urination, excessive hunger. Some people lose weight, that's usually with a type 1 diabetic. Feeling tired or fatigued is also a sign of having high blood sugar levels. But on the flip side, you can also have feelings of a low blood sugar. We call that hypoglycemia. And what that feels like, some people get shaky, nervous. You have night sweats. Again, some people have increased urination and thirst. If you know that you're diabetic, always keep something at your bedside or something in your purse for when you're traveling, hard candy, a small amount of juice in case that you have those times where you have a low blood sugar and you're not able to eat a meal at that time. Let's talk about the importance of having a primary care provider. They can do what we call a finger stick, which will mean they will check your blood sugar as it is at that moment. Sometimes that's not as accurate because say you just went to McDonald's and had a Big Mac or had a sweet tea. Your blood sugar will be high. Or we can do something called an A1C, which is a 3-month average of your blood sugars. That is a more accurate picture because I can tell what has happened over the last 3 months versus what's happening right now. We use this to diagnose diabetes. Some people will walk around with diabetes for years and not know they have it. Some people will develop symptoms immediately, and those are usually the type 1 diabetics due to the inability of the body to make insulin. How can diabetes be treated? We recommend that you start with diet and lifestyle changes, such as increasing your physical activity, decreasing your carbohydrate or processed sugars and starches. Also, make sure that you are trying to maintain a healthy weight. If you have a family history, it's good to get the whole family involved in the lifestyle changes. We also have pills available. We have oral medications that also help the body to make more insulin or decrease the sugar that is produced from the liver. Or if you have advanced stages of diabetes, we also may have to start you on insulin so that you will have to take shots every day. I'm Karen Whitaker, and this is your Health Note. For more information, contact me at the OIC Community Health Education Center at 252-212-5499.